and we're actually witnessing a procedure even as we speak. This is a less invasive procedure to fight the, clock. Gail Humble, who is to your right there, and Dr. Douglas Mest, who is to your left, they're actually performing a procedure on Veronica here because she wanted to take a few years off. Gail, and we don't want to gross out anybody at home, so we're not going to get too close and whatnot. But Gail, Dr. Gail, exactly what are you doing? Because it is surgical, but it's less invasive?
It's surgical, but it's all done with a needle, and the needle is attached to a polypropylene thread with unidirectional cogs. This is the basis of all the feather lifts. This is the only FDA-approved suture, though. It is unidirectional. We pass it through the tissue. Mm-hmm. It is basically a skin lift.
A skin lift. So that's the difference between a surgical procedure as opposed to what you're doing.
It's for a younger patient or perhaps a patient that's previously had a facelift but doesn't have a lot of excess tissue to move.
Okay.
The procedure is relatively brief in duration, and the recovery time is much less as well.
How long is her procedure going to take this morning?
We're doing 4 threads on each side of Veronica, and the entire procedure should take about 30 to 45 minutes.
And so next hour we should be able to see a final result?
As soon as we do the other side, we'll sit her up and we'll begin the second stage of this procedure, which is the contouring and the most exciting part.
Now, we just want to show you the equipment that's being used. Can we just move this down here? I made a joke earlier about using some rope and pulling yourself up, but that is the thread that we're looking at that you're actually placing and using in your procedure.
That's correct. Part of the thread is a normal polypropylene, and part of it has these unidirectional cogs. I don't know if your camera can catch that. Angie can show you another one where you can get a close-up if you'd like to.
Yes, we're looking at that. Now, what does this what's the pricing on this? How does this compare with a traditional facelift?
Well, obviously, it's much less. Not only is the procedure less, it runs about $400 a thread, including the OR setup and the anesthesia fee. Of course, the fee varies based on the area you're in.
Can I ask a quick question?
The recovery time is less as well.
All right, hold on, Dr. Gale. Yes, go ahead, Michaela.
Because it's less invasive, because we're not getting too close, we can't see too close up. But is there any concern about it giving? Do you know what I mean, doctor? That it won't hold or it won't stay?
Yeah, Michaela's wondering how long will this last? Will it stay?
Well, the polypropylene sutures, of course, are permanent. However, we go for all clinical results lasting at least 2 years. That's considered an aging period. Your normal facelift will last 5 to 7 years.
Okay. And as we go, let me just show you the kind of results she's getting here. Now, this is a patient before on your left, after on your right. That's 1 day post-op. I'm amazed. All right, let me give you some information. This is called the Contour Thread Lift. There's the phone number if you'd like to get more information, and you can certainly go to our website, ktla.com, for the medical group with Dr. Gail Humble, Dr. Douglas Mest. This is patient Veronica who said, look, there's some crazy business going on around my mouth and my eyes. I'd like to do something, but I don't want a facelift. And that's what this Contour Thread Lift business is about. It's improving people. She's not trying to look 10 again, but you're trying to smooth things out.
Just give Mother Nature a little fight.
Okay, a little fight. I like that. So now, Gail, Gail and Dr. Douglas, what has happened here? We see some bandages on her face. We see some things pulled up. What's happened?
Well, Veronica's had the Contour Thread Lift. She had it on her face. We also do it on the brow and the neck. In her case, we decided to go ahead and do 4 threads on each side. The whole procedure took about maybe 30 minutes. And the patient's going to have a few days off, but she's going to be able to return to work.
All right, let us show you a little bit of videotape of how you were doing this. After you put the threads in, this is the part that makes this different from a thread lift. This is the contouring part. Explain this, what we're looking at here.
In this tape that you're looking at, we're contouring the skin up and over the tape, over the thread. And you can see that we're tightening the skin, and you'll see some redundant skin in the corner. However, this redundancy will redistribute over time.
Really?
And in 2 weeks, you won't see the skin overlapping in the corner. She'll have a smooth appearance. It'll be uplifted. And she probably gets about 25% of the results with a traditional facelift, which has much more downtime and more cost.
Now, this is the thread you're using with the needle attached. What's that little white doohickey on the end there?
This is just a piece of styrofoam that's blocking the sharp edge. But we have both a curved end and a sharp end on this thread.
Almost looks like a fishing hook. I'm sorry.
Now, the next few months, they are coming out with a bioabsorbable suture that will disappear with time, so you can have multiple thread lifts done every few years.
So like when you have a procedure and you don't have to go and have the threads taken out?
Exactly.
They'll just disappear.
Right, and we're expecting that in a few months. There's also one step beyond this where, in addition to doing the threads, we free up the tissue and raise a flap. But, of course, that has more downtime, more morbidity, and more cost.
Gail?
Yes, go ahead.
How about a recovery? Does she have to be careful not to move her face?
Does she have to be
Over
careful?
the next 2 weeks, she's going to want to keep a little more immobile. She's not going to want to have a big smile. And, of course, she'll spend some time sitting up in the evening and icing.
Now, here's a before and after picture. You wanted people to get an idea of what Veronica's going to have, what's going to happen to Veronica here after the extra skin starts to disappear. Before here, after there.
This patient's about 4 months out. She has a smooth contour and uplifting to the face and looks much younger.
All right.
A question for the patient.
Go ahead. She can hear you.
Did her family support her decision?
Veronica, they want to know, Michaela wants to know, did your family support your decision?
Couple sisters did, couple sisters didn't, but my husband he's like, yeah, do it if you want.
Oh, the hubby hung in there.
Most importantly, Veronica's having her 1-year anniversary, and he asked her what she wanted. And she said, I'd like you to put ice on my face for our anniversary.
Wow. And here's another before and after so you can get an idea of what kind of improvement you can get with this. This is 6 months after post-op.
Wow. Right. And the results will last. We say up to 2 years, but your traditional facelift, as we discussed, lasts about 5 to 7 years.